Hello, my name is Phil Resbrook, and I appreciate y'all coming here today. This is an introduction to the upcoming webinar with Michael Pinto to discuss the coronavirus and an appropriate response. But first, I wanted to talk a little bit about kind of a setup for this and at least my thoughts about the situation and what we're encountering and ways in which you and your company can respond to it appropriately. So let's start with just some thoughts here. The first, let's talk about this conflict that exists. This conflict between fear and desire. We have fear because we have risk. We have fear of unknown. We don't know what we're dealing with, and this is an environment in which there's lots of misinformation and new information and changing information. So that creates this fear. But on the other side of it, we have this desire, and this desire is for reward and desire to be prepared properly and to provide a safe working environment for our employees and to provide safety for the people we're working for and the buildings we're working in. And so we're in a time right now. Today is March the 5th, and I'm sure by March the 6th or even this afternoon, a lot of the information that we have today will be different, and maybe things will have changed. And so this desire is going to feed our businesses and this opportunity to address an issue for the community at whole, and it's going to benefit us and our company. And so we have this battle between fear and desire, and having appropriate response to the situation that we're dealing with right now. So first, let's talk about what we do know. And I had done some research up through last night, and so this is new as of now. This is a new virus. It's something we hadn't seen before. It's very contagious. So what I've read and what I understand is the average person will spread this to 2 or 3 people before they even have symptoms. And so that makes this an exponential risk. And what we know today or what we're dealing with today is much different than what we're going to deal with tomorrow. And we combine this with this fear of the unknown. It's being treated like it's Ebola, but it may be more akin to the flu. We don't really know. And so there's this fear of this unknown, and there's lots of misinformation or people who claim to be experts in this area, and they may or may not be. And so there's fear. And so we know that that's driving a lot of what's happening. We know that restoration professionals are ideally suited to respond to the situation. This isn't radically different than dealing in the healthcare environments as we currently are. Some of us are dealing with infectious disease or at least working in mold remediation, asbestos, things that lead paint, things that are impacting health and livelihoods of people. And so restorers are ideally suited to respond. We just need to learn a new skill set or add a little bit to our tool bag. We do know that this virus affects the lungs. So it's maybe a different bit, it has a different reaction or interaction with individuals. We also know it can be deadly. We don't know how deadly, but we know that it can be deadly. And I believe that Michael will talk about in some of his slides coming up, the level of risk and mortality that we have. And it is kind of a changing number. We also know that it's all over the news. This is, I don't think we can escape this, that it's on social media, it's all over the blogs, it's on talk radio, it's on the news, it's everywhere. And so that's going to impact and drive this issue and maybe make it more so, it's going to drive it in areas that aren't as necessarily logical or reasonable, but it will drive because we have fear and we have fear of unknown, and it's contagious and it's changing. And so those are the things we do know. And let's talk about what we don't know. We don't know how long this has been spreading. There's rumors that it could have started in November or December, that I've read and heard that it could have been present in the United States much longer than we thought it had. We just don't really know. And there's probably no way to figure out some of that. We don't know what the progression will be. We don't know what it's going to look like. That's why I said I gave you a date, because I think tomorrow this could be different, good or bad. We don't know if there's an end. We don't know if this is going to be like the flu virus that will be seasonal. We just don't know that. We don't understand how it's transmitted. Here's a big one for restorers. We don't know how long the virus lives on surfaces. So if it's 45 minutes, that's one issue. If it's 4 weeks, that's another issue, and it requires a different response. And the professionals in the industry don't necessarily know that. We don't have a treatment or vaccines like we do for the flu virus, so it adds another level of concern. We don't know the mortality. We have some numbers. I've seen numbers that change from 0.9% to well over 4%. Well, you know what? That's a big difference. And I think Michael's going to show some things that the mortality is substantially different based on age and health risk. And what I think that all of this stuff means that rumors are going to take over, and rumors are going to start pushing agendas, and they're going to start pushing fear or community or responses, and some good, some bad, but know that it is rumors that will drive some of this. Here's an example of maybe some different ways you can look at the story. So Bill Gates has said this may be a once in a lifetime pathogen that we've been worried about. So I hope it's not that bad, but we should assume that it is until we know otherwise. He's putting $100 million into research into this. So he's definitely vested in this. On the other side of it, the head of the CDC, Robert Redfield, has said the risk is low. The risk is low. Well, those are quite different stories between the two of those. And I think that just goes to show the uncertainty that we have and the uncertainty in this whole virus. So let's talk. Here's what we're going to cover today in the presentation. The first is we're going to talk about how to protect your workspace. I think you got to be a steward of your resources, of your employees, of your office. Put yourself in a position to be able to appropriately respond to the need that's showing up. We have to talk about how to protect our employees who are working in a potentially contaminated environment, or simply protect them because they're working in a group environment in your office. We're going to talk about how to provide a clean environment. And we're also going to discuss what the definitions or the terms and the vernacular is around this. So we're going to define clean, and then we're going to talk about cleaning options. And then also at the end of this, we're going to have Ross Driscoll come in, and he's going to talk about what you can look for from your insurance policies. And one of the things as a business owner or manager, you really want to look and say, how can I manage the risk in my business? And so one of the risk things that we can do is we can push off some of that to our insurance and our insurance policies to make sure that we're properly covered. So Ross is going to come in for a short period of time and just discuss some of those issues. What we're not going to cover today, we're not going to cover legal and contractual issues. We're not going to cover waivers of liability, contracts, or legal description of results. That's I won't have an attorney that is sitting in on this presentation, but I do recommend you do talk to your attorneys, that you make sure that you have appropriately addressed the legal issues as they pertain to your business, your community, your state, and then some federal laws, whether you're in Canada or in the U.S. So that is an important element you will have to take care of yourself. And we will not discuss pricing. Pricing is going to be very different, and I think there's going to become certain best practices, but we're not going to discuss that at all in this presentation. So with that, what I want to do is get right to the presentation. I'd like to introduce Dr. Michael Pinto, President of Wonder Makers Environmental. He will be fulfilling in some of his personal bio as well during his presentation. So with that, I'd like to introduce Michael Pinto. Thank you very much.
As Phil suggested, we've got a lot to go through. I'm going to twist it just a little bit here. I think it's important that everybody have a foundation in terms of general infection control. So I've got 15 or 16 slides on that. That'll be 10 minutes or so. Then I do want to jump in an expanded version of what we know about coronavirus. Probably the two biggest ones for you guys are going to be the types of services that I see that can be offered, and the infection control cleaning procedures. That's where we'll talk quite a bit about some of the different technologies and things.
Michael, can you stop for a minute? Somebody has some background noise on there, and if you're listening in, can you put it on mute? We'll have a time for some calls afterwards.
Yeah,
afterwards.
Phil, I'm getting some emails that people says it still says host will let you in soon.
I just saw those people were not there, and I have let them in. So everybody should be there now at this point.
And it sounds like the background noise is gone, Phil.
Yeah,
so-
background noise is gone. All right. Sorry, Michael. We're good.
Okay. And then some summary, and there's no way that I'm going to get to the bonus material, but if people have questions about ATP and how it works, even though it doesn't actually identify viruses, it still can be very useful. So the best way to start this, though, is to talk about some questions that you should be considering. What are you doing? What could you be doing? And what should you be doing? And those are related questions, but they're different. And the interesting thing about this, with all the different contractors that I'm dealing with and everything, everybody has their own toolbox. Everybody has different procedures and processes and chemistries and equipment and things that they like. And one of the main things I'm telling people is that most restoration contractors have the tools in the toolbox to do a good job with this already. They don't necessarily have to go out and buy any new sort of something or other. So we'll talk about that. So let's just jump into it. And I told you we're going to go really fast through this material for two reasons. One, I've got a lot that I'd like to share with you. Some of this foundational stuff, some of you probably already know. Third, Phil is recording this, so if you need more time to digest some of this, you can go back to it. So I just want to start here. We really have some bad news and some good news regarding infection control, particularly as we're dealing with the coronavirus and the scare and the publicity and things that Phil was talking about. On the bad news side, you can see that there's a public awareness, and of course, when you have what could turn into a pandemic, that will certainly bring the public's attention to it. I think the hyper-partisanship of the politics right now is also adding to that, just because it's a whole big gotcha game. But this awareness also then brings people to the thought process, well, somebody needs to do something there. How come somebody's not taking care of us? Ultimately, they start with the government, and then eventually they'll back their way down. And many times it comes down to, healthcare people and custodial and maintenance in the healthcare and in other areas. And that's where we interface with them on that level. The good news, as you can see there, is that we just literally have an explosion of things that can be very helpful with this. People ask me for the last several weeks, what do I think of the coronavirus and coming here? And is it going to be horrible? And are we going to have thousands and thousands of deaths? And the potential is, yeah, it could be that big. But I think we're in a lot better shape to deal with it than the Chinese, just because we have a base of equipment and contractors that can step in to help the government. It doesn't have to be just the government or the military. So I would consider the first best step for all of the contractors that are on this webinar is to make sure that you're educating everyone about the basics of infection control. Here's a simple diagram. There's all sorts of information available. We'll talk to you about that in a minute. But it's all about breaking that chain of transmission in one place or another. Here's a little simplified version of that. It's basically, we have infectious agents, and now it's this new one, this coronavirus. Where do those viruses hang out? Phil was talking about how long do they hang out? How do they get into individuals? And who's the host? And then if they get sick, how does that start the process all over again? And the quick answer to dealing with that chain of infection and breaking that chain is just understanding the basics, the big picture view. And this is it. Occupant activities. There's study after study after study, whether it's flu, coronavirus, avian flu, H1N1, swine flu, previous, all of these things that we've had before, even going back to the pandemic flu in 1918 that killed hundreds of thousands of people in the US. Occupant activities is about 50% of the answer, and the building environment is the other 50%. Some of these things we can control during an outbreak, some of them can't. Under building environment, for example, design and construction. If they're building hospitals, for example, with bed rails and touch points and things like that that are non-reactive, that are actually preventing the spread of infectious agents by using copper and silver alloys and things like that, that's great. At this point in time, it's too late for us to worry about that. Then it's going to be maintenance and custodial issues, and then how do they deal with bigger problems. On the personnel side, it's really about isolating impacted people and then using appropriate personal protective equipment. Another way to look at this is just, again, taking it down to the most simple. When you think about occupant behavior and environment, it's a simple formula. If your hands aren't clean and they touch common surfaces, then that's going to contaminate those surfaces, and then your infection is going to continue to transmit. The CDC is making a big thing about the coronavirus being an airborne to airborne transmission, and that's true. All flu and many diseases are like that, TB, for example, but study after study after study shows that the bigger concern is the airborne transmission to the surfaces, and then the surfaces then transmit those microorganisms back to another person, and then they touch their face. The fact of the matter is that you folks are trained professionals in this field, and you can break that transmission chain. The two big things in a general sense is, what are your own personnel policies going to be in terms of helping your crew stay safe and not infect other people? And then using the skills that you already have and a lot of the technology that you already have, and do some cleaning for health so that we can eliminate pathogens. This picture on the right-hand side, I was just down in St. Louis at a restoration contractor giving an infection control risk assessment class last Friday. And at about 10 o'clock in the morning, I noticed there's a couple of people that were sitting in the class that didn't look so great, and talked to them at the first break, and they said they were feeling just a little flush and stuff. So talked to the building owner about getting them out of the classroom, first of all, or if they were going to stay, at least wear a protective mask. And then at an unscheduled break, because they had this technology available, they brought in one of their crew members to do the sanitization there with the electrostatic sprayer. And you can see him. We had moved all the students out of the classroom. He did the sanitization for 20 minutes, and we brought people back in. Now, whether it was psychological or the fact that we had gotten our potential vector people out of there, I'm not sure, but everybody seemed to be a lot happier during the class, and I didn't get sick, which is the most important thing, right? That's a joke, people. When you deal with trying to clean surfaces and touch points, and again, we'll roll back and we'll talk a little bit later about personnel policies and how we deal with individuals that might be sick and keeping them from getting sick. But as far as you guys are concerned, your primary effort to help people is going to be related to cleaning and sanitizing different environmental surfaces, whether it be vehicles or buildings or healthcare facilities or whatever. And as far as touch points go, hands are the number one. I mean, if you can't keep your hands clean, and the doctors and the nurses don't keep their hands clean and use protective gloves, that's where it all starts. As far as our environmental services, there is your hierarchy of things that you want to clean and sanitize. Hand contact surfaces, what we call touch points, food contact surfaces, and then, believe it or not, the cleaning cloths and utensils, because if we have contaminated dish rags, for example, then we end up with all sorts of contaminated surfaces and dishes and things like that. The second tier down from there, or the third tier after hands and hand contact surfaces, clothings and linens. And then notice on the right-hand side there, toilets, baths, sinks, and wash basins. Those are all key areas in terms of infection control. If I don't think about it and I forgot to put a picture in, I want to cover it right now. One of the best things you can do for your business, if you don't already have it, is think about taking the toilet seats off the toilets, if they're just the standard kind of industrial ones, and put on ones that have covers. And then train your own staff that after they use the toilet facilities, before they flush, they actually put the lid down before they push the flush lever. And that makes such a difference in terms of overall dispersion of microorganisms in a bathroom. Uh, you can see there the stuff that actually we see a lot of pictures of during these pandemics, people spraying floors and walls and wiping down furniture and things like that, unless they're desk or tabletops or computer tables or something that has a lot of hand contact to it. That really is pretty low in terms of actually creating some benefit to the people in the building. So Phil was talking briefly in his introduction that we don't even know how long this uh, the coronavirus, this new coronavirus lasts. And you can see down on the bottom there on the right-hand side, it's called SARS COVID-2. And it, compared to a lot of other things, the gram-positive bacteria and some of the gram-negative bacteria and the rotaviruses and things like that, the respiratory viruses, which this is one of, usually only last hours or days. The latest information we have, and that was released last night from the CDC, is that the testing that they've done indicates that this new coronavirus can last anywhere from a few hours to up to 9 days. And so that is going to be interesting. It's not just going to burn itself out potentially over a 3-day weekend, like if a school shuts on Friday. In the case of a normal flu, a lot of times, even if they didn't do any cleaning and sanitization of the desk, after a 3-day weekend, you come back and the transmission rate is going to be way down. But that's not necessarily going to be the case with this new one. Another way to look at it is just, again, understand some of the things that we need to focus on. And even if there's a high chance of pathogens being present, like in the toilets and stuff, the risk of spreading those pathogens is generally fairly low. But if the pathogen is pretty aggressive, like this new coronavirus, then we want to take care of that too, which may, as I said, involve using toilet seats instead of just open toilet tops. But then you get into some of these other reservoirs, wet cloths and sponges and cleaning utensils. They tend to have a lot of pathogens on them because that's what they're supposed to be doing, is cleaning them off different materials. And so the risk of spreading it by using those is going to be fairly high or constant. Hands, hand contact surfaces, or what we call the touch points. And then again, you walk down the list there, similar to the chart that I showed you before. It just gives you an idea that it's not just where the highest number of bacteria are or viruses, it's where and how they're spread that makes a difference to us. So what does that mean? And how can you be prepared when we have some of this general information? We understand that regardless of the type of pandemic or epidemic, there's certain areas of the community that's going to be impacted. Healthcare facilities, number one, just because that's where a lot of the sick people go. In the community, you're going to see schools and gyms, and businesses, especially retail businesses, are going to be impacted. Food preparation places, for sure. Cruise ships, you're already seeing that. They're canceling trips. They're pulling them out of service. They're taking a huge hit on that. Homes are usually pretty safe until you bring an at-risk individual into the mix. That would be somebody who's got underlying health effects or who has been exposed to the virus. So with that, let's talk about specifically what do we know about coronaviruses. And the fact of the matter is, we don't have a lot of good news about coronaviruses. This is just as of last week, and things are moving very quickly. But even as of last week, the officials at the CDC and stuff were saying it's not about whether it is or if it's going to come to the United States, but rather when it's going to come to the United States. We just had a industry association that canceled their annual meeting in Seattle, Washington, because that's pretty much become the current epicenter of some of the problems with the coronavirus here in the United States. So, what is this, and why is it called this novel coronavirus, which just actually means new? Essentially, it's a new mutation. Coronaviruses are around all the time. Um, when it was detected in China is again another um, big debate. But right now, we know that it's in at least 70 locations internationally. It has this interesting name, SARS-CoV-2, and that's the kind of the medical industry um, abbreviation for the severe acute respiratory syndrome, or SARS. So anybody who remembers and has been around in the industry more than a few years may remember in 2003, we had this first mutation of a coronavirus that absolutely went after the respiratory tract and created this series of symptoms, which they ended up naming SARS. Uh, Acute meaning that it happens very quickly, severe meaning that it's not something that is easily gotten over for many people. And then, of course, it was attacking the respiratory tract. So that's how you ended up with severe acute respiratory syndrome, or SARS. In 2003, that literally paralyzed the entire city of Toronto for several weeks, very similar to what you're seeing in terms of Wuhan, China, and stuff. So that's the viral contaminant, is what they're officially calling this SARS-CoV-2. The disease that it causes is the one that most people are familiar with, the coronavirus disease 2019, or they're abbreviating that COVID-19. So that's the terminology. That's what we're going to be talking about here. So when we're talking about the actual infectious agent, we're using the SARS-CoV-2, and this was pulled off of the internet last night. So just within the last 24 hours, you can see most of the cases in China, South Korea, pretty badly hit. United States, I heard this morning, is up from 103, but these are known cases. We'll talk to you a little bit about that in just a minute, why that's running behind. The question really that's important to us is, what do we really know about this? And the answer is that we've got a lot of people doing a lot of cleaning in a lot of bad ways. But the answer is that it is a very contagious virus, and otherwise healthy individuals can get this virus and tolerate it. In other words, they'll get over it. The numbers here are just a little bit dicey because we still have so much information that we're relying on from China. But right now, it's about 20% of the patients may not just recover at home. That's a big percentage. That's probably bigger than the average flu. About 4 or 5% of the average flu population requires medical treatment instead of just bed rest, chicken soup, and that sort of stuff. So if that jumps from 5% of the impacted people to 20%, we could have a lot of hospitalizations. And about 2% of the infected individuals will die from upper respiratory complications. You heard Phil say that we don't know if that's really a good number. Is it 0.9? Is it 4%? 2% doesn't sound like a lot, but if you have a massive number of people that are impacted, if you have 200 million people and you've got a 2% a death rate, that would be 4 million people that could potentially be exposed and suffer fatalities. I will tell you, if you look at their happy face. The CDC is talking about how prepared they are and all that. But if you dig deeper into their stuff and go on the medical side where they're talking to the doctors and things, they really are preparing for the worst. One of the best indications of that is they're talking about potential shortages of some of the critical safety equipment. They're already telling people not to use N95s in the general public because they're trying to save them for the healthcare professionals and stuff. So the example is the photo here. If the public doesn't even know how to put on a respirator properly, which neither of these individuals do, the one has it upside down. The other one didn't even bother to bend the metal nose strip to fit. If they're not using it properly, how much of a use is it? And is it just using up those respirators that may be in short supply for the medical community and the first responders and the restoration industry that actually needs it? So gloves, gowns, or some sort of suits, eye protection and respirators, that's what the CDC is recommending for the healthcare professionals, but not necessarily for the general public. I think it's really important for us to understand that there are some what I call key vulnerabilities. In other words, what is it that we need to know about this disease? And the information is still coming in. I don't want to pretend I'm a medical doctor or anything like that. But just backing up and following the information and looking at what we've got as of, Thursday, the 5th of March, I can tell you that there's some things that we need to focus on. And I hope that this slide doesn't come across as being inappropriate by linking fatalities and things to what we would consider a service or our client base. But it's important that you get ready for this. One of the primary areas that we may need to reach out as an industry and help people is in the elder care industry. And that's going to be your nursing homes and your senior centers and that sort of stuff. The mortality rate is very much focused on older people with this virus. As someone put it bluntly, it's culling the herd of all of us oldsters. But if you're over 60, and I get to join that club, or I'm in that club, and certainly if you're older than 80, this could be a really high risk situation for you. The ones here that are in the United States, the 3 that were reported over there in King County, Washington, 3 of those all came from a single nursing center. So if it gets into some of these elder care rehab facilities, senior citizens apartments, that sort of stuff, it could be awful. And that's why I say I think that becomes potentially a prime client base for the contractors, and why you have to potentially think about being proactive on this rather than reactive. We'll talk about that in just another couple of slides. Another vulnerability is going to be the healthcare providers. You can see the numbers up there in China were absolutely awful when you had over 1,700 personnel in China infected with more than 1,000 in the core city Wuhan. You would think that the medical professionals would know how to protect themselves. Study after study says no. And many times that's hospitals being slow to adopt best practices that we in the restoration industry already know. So for example, in 2003 with SARS, there was a big debate about whether the hospital individuals, nurses, and even environmental staff should wear masks or should they just wear surgical masks as compared to an N95. And they chose primarily for financial reasons because they didn't want to pay for the mask and they didn't want to train and fit test people to go with a surgical mask. And it turned out that that virus, very similar to the current virus, was causing more illnesses and even some fatalities in the Toronto hospitals than what there should have been. So right now, in the Bay Area and San Francisco area, and in the Seattle, Washington area, we've got a number of people that have been tested positive for the new virus. And then you have to think long term, what is that going to do to the hospital staff if we have a bunch of people that are working in them and start self-quarantining, or if they actually get sick enough that now they have to go back into the um, healthcare facilities. And my history on this goes all the way back to when I was doing training for the Ebola virus for the contractors out in New York City, and watching the situation in Dallas where two um, emergency care nurses actually ended up contracting Ebola, and how that virtually um, you know stressed out that whole hospital to the point where there wasn't any other services that they could provide in that particular area, at least in the Ebola area, because they were so busy dealing with just two individuals. Um, the last of the big vulnerabilities from my standpoint is that and again, I'm not a medical doctor, so this is take this one with a grain of salt, but I just don't believe this to be a situation where we've got strong diagnostic tools. And the key there is that the virus is not always detected in the current tests that are available from the CDC in the early stages of infection. In other words, people can be carriers, not know it from the symptoms, and even if we test them as potential carriers, we're not getting good results back from the test. So what this comes down to for the restoration contractors is that managing your staff is going to be key. What does this all point to in terms of this particular illness? I think we've got uh, to expect lots of absenteeism in our own companies and in schools and that sort of stuff. And of course, if schools shut down and childcare centers shut down, then that impacts our workplaces because the parents who work in the workplaces don't have anybody to take care of their kids. We could be looking at overloaded healthcare systems, and we could even have law enforcement and ambulances and things like that that are also impacted. Of course, um, one of the problems they have in Wuhan is that they're just not getting the supplies they need because they don't have the truckers. So we're already being impacted. Here's a picture of Bothell High School, and that's in Washington. And they closed last week for several days. A couple of their employees had traveled overseas. This was to Europe, not necessarily to China. But as they came back, the superintendent was talking to different health professionals. And even though they said the risk was low, they couldn't tell her that the risk was zero. And so they essentially shut down the campus there and supposedly disinfected that as a preventative measure. How well they did that is hard for us to know. Um, Both the World Health Organization and CDC agree. We don't have any vaccine at this point. And so, as you can see there, non-pharmaceutical intervention. The translation of that, infection control, and taking care of people at home are going to be the keys for this particular virus. So the CDC's recommendations are right here. Avoid people who are sick, nose and mouth, hand to face, minimize some of that. Use good hand hygiene and disinfect surfaces. Um, you can see there some of the existing products that we use in the industry. Certainly one that's familiar to a lot of you is Shockwave. You can see how they're tested against human coronaviruses as part of their existing registration. That doesn't necessarily mean that it's this particular strain of the virus or mutation of the virus, but generally, when the chemicals are effective against that class of virus, the human coronavirus, um, the different strains, it's still going to get after them pretty well. All right, probably the biggest section for you folks today is what should you be thinking about and what sort of services should you offer? And I want to go after this in this particular fashion, and that is those three questions that I asked early on. What are we doing? What could we be doing? And what should we be doing? So from what are we doing? I'm assuming that many of you are like us here at Wonder Makers. You're trying to, move forward with your normal business, but just by being on this webinar, it means that you're getting ready for some additional demand or wondering if it's out there. So you're questioning different people, trying to get some good information as compared to just trying to pick things up from the internet and figure out what's real and what's not real. What could you be doing? Well, uh, the planning and the preparing is one thing that we've talked about, and the marketing and prioritizing. If it really gets bad, prioritizing is going to be important. That's going to mean that you're uh, literally deciding which clients or which potential clients you want to take on because you may not have enough manpower, chemicals, or supplies to deal with them all. I would say this: what should we be doing is looking at it from these three perspectives. How are we protecting ourselves and our crew? How are we going to then protect our clients? And then I would also go forward and say, how are we going to protect the public? Let's take a look at each one of those, remembering that each and every one of those is going to be a combination of both occupant activities and what we can do to the building environment. So, number one, how are we protecting ourselves and our crew? The biggest thing is that you have to start telling people now that you're going to enforce a real sick policy, meaning that if people show any sorts of symptoms or have any potential contact with known individuals that have the coronavirus, then they're not going to be able to come to work. You can't afford to have, the proverbial typhoid Mary come in and spread it to everybody in your operation. Then you're not going to be any good to anybody else. If you do have people that come into work because they're asymptomatic until they get to work, they work half a day and now they're not starting to feel very good, like those individuals that were in the class where I was talking to you about last week, have surgical masks available to put on them as you're getting them out the door. And remember, the surgical masks are not enough to protect you as a well person from some of the airborne transmission. But what it does do for a sick person is keep them from spreading it around. They don't necessarily have to cough into their elbow or into um, a Kleenex or anything like that. If they cough or if they sneeze, it's going into the mask, and then they're the only ones who are most likely the only ones that are impacted. Educating your staff, this should just be ongoing. Cough etiquette, hand washing, not just educate them, but make it easy for them if they're going to wash their hands more often. Do you have lotion stations, or are you using the lotion soap so that people's hands are drying out if they're just using a lot of the um, sanitizers and stuff? By the way, the hand sanitizers have been shown not to be quite as effective against this particular form of the virus. So that's interesting. Uh, the last one there is probably the most important. Are you cleaning? Are you taking the same care to clean and sanitize your facility and your vehicles that you are for your clients? The picture again of the classroom there where I was last week, that's a proactive rather than a reactive move. More importantly, it shows your own staff that you care enough about them that you're going to try and protect them in the workplace before you go out and try and help some other people. As far as educating people, just there's scads of information out there in terms of how to educate people. You can't put too many of these posters up, in my opinion, if this thing actually gets rolling around. So just again, go to credible sources, go to the CDC. That's the one on the left is from the CDC. The one on the right is from the California Public Health Department and some of their partners and things. But get this stuff up, get people thinking about it. Obviously, if you're going to have people going out and assisting with other clients and providing disinfection services and cleaning services, you need to protect them on the job. That's the proper PPE. And it's not just throwing the PPE at them, it's training them. Hopefully, a lot of your crews are already used to this, but you may actually be doing an all hands on deck. You may be bringing fire crews out to do disinfection and special virus cleaning. Well, they're used to dealing with smoke and soot. You need to cross train them, make sure that they're ready for the viruses and stuff. That last one is the most important. You got to have rules and it's got to be no exceptions. If we're in a situation where they need to be wearing respiratory protection, eye protection, suits and gloves, that's what they need to be wearing, not just kind of wearing it or I'm a supervisor, I'm not going to be here very long, so I don't have to wear it. As far as the respiratory protection goes, remember if you're bringing people in to, again, kind of all hands on deck, uh, if you're going to put a respirator on them and the filtering face pieces are indeed respirators, they have to be part of that respiratory protection program, which means that you have to have the written program, they have to have training, medical evaluations, and fit tests. That's what screwed them up in 2003 in Toronto in the hospitals, is that basically they didn't want to follow the rules for um, putting people in respirators. And surgical masks are not considered to be respirators. So they left them in surgical masks, and they ended up literally killing people. Right now, the CDC recommendation is a N95 respirator. I would tell you that at Wonder Makers, and for years, I have said in a situation like this, our specific recommendation is an N100. If you want to know the type that we use at Wonder Makers, it's the 3M one shown right there. We've done a fair amount of testing, at least in terms of having people wear them and which ones seem to fit the best and which ones are the most comfortable and that sort of stuff. And I'm just telling you, you can buy whatever you want, but if you want our advice, try and see if you can get a hold of the 3M N100s. Right now, those might be more available than the N95 because there seems to be a run on the N95s. More things we can talk about in-house, but those are some of the basics. And then we move to number 2 there in terms of what we should be doing protecting our clients. One of the best ways to do that is get out there and proactively, as in starting now, sending out emails, sending out notices, having your salespeople stop in and just remind them, hey, you're an existing client. We've got you on a pre-service agreement in case there's a tornado or a flood or a fire. Realize that if you want our help with coronavirus, if it reaches into this area, we have these sorts of services that can help you. We can do detailed cleaning to touch points to help your janitorial crew. We can sanitize things. And more importantly, we can apply some of these really cool preventative products. And then even don't think about it as losing business. Think about gaining relationships. Talk to them about training their maintenance teams or their custodial teams or their environmental services team, whatever they call it, so that they can do better cleaning and even perhaps guide them in terms of the sorts of products and chemistry that we're going to talk about in the next few slides here so that they can do a better job with it. Uh, of course, what you want to do is make sure that any of what I call the sophisticated services, such as this EvaClean or Clorox 360 or any of the others that are out there, that you are absolutely able to provide those services to them. So here's some of the things that might be considered sophisticated services. Notice we've got 2 different pictures here of people using electrostatic sprayers. Actually, might actually be the same unit to do some post-cleaning disinfection, and one person is using it absolutely wrong, which is the guy up on top with no personal protective equipment, and then the guy at the bottom at least has some respiratory protection and some gloves. But if you're actually in there to sanitize or to clean, you need to protect your crew, and that means putting them into the appropriate personal protective equipment. SteriMist, ProCure, those are all specialty sanitizers, foam cleaners, ULV fogging, electrostatic spraying, brew tabs, EvaClean. There's all sorts of them out there. Even the use of hydroxyl radical generators, I'm a big fan of those for prevention, not necessarily reaction. And we'll talk about that in a little bit. As far as other preventative steps, the application of some of these surface biostats, generally those are organosilines. The one that I'm most familiar with is BioShield 75, but there's lots of them that are out there. And it basically has this technology over here on the left where it leaves on the surface what they call these microscopic spikes, but they're charged, and so it actually draws some of the viruses and the bacteria to them and damages those cells and kills them. So you're literally cleaning surfaces, sanitizing surfaces, and then putting some of these preventative materials on them is going to be very useful, particularly if these viruses can last up to 9 days on a surface that's not treated. The hydroxyl radicals, I think, are great machines once we get the air clean and the surfaces clean to help keep it clean, uh, much better than trying to use the ozone generators and stuff like that. Other ways that you need to be prepared to help, you may find out if the nursing homes and the hospitals get overwhelmed that they need to start creating more isolation areas in the hospital under negative pressure so that we're not just continuing to spread it to all the other patients. And you can do that. You guys know how to build large negative pressure enclosures for mold and for um, uh, drying, to build drying chambers and stuff. If you've got content services, you may have to reach out and help them with some of the controlled laundry and doing the infection control on the laundry. I know that they have their own laundry services and things, but particularly if you happen to have an Asporta or other sorts of technology that has been proven to clean sewage waste and things like that, other pathogens, that can be useful for the medical community. Regardless of what you do, whether you offer a suite of services or just a single service, whether you offer it to a lot of clients or to just one client, do it right. Make sure that you've got the right isolation, the proper personal protective equipment. If you're using chemicals, that you're mixing and applying them right, making sure that it stays wet for the appropriate dwell time. After the chemicals go on, if there's neutralization, make sure you're doing that. And most importantly, as Mr. Driscoll will talk about from an insurance standpoint, make sure you've got your documentation down. As far as protecting the public, I think part of it is sharing expertise. Um, Anybody who's interested can shoot me an email or shoot Phil an email. It was just Wednesday night. I did an interview for the local TV channel and just talked to them about what happens and how we can handle things if the coronavirus comes to the Kalamazoo, Michigan area. You can see there's a picture of one of our contractors that had provided some equipment to the television station there in Texas. But that's what it's about, is not only just getting your name out, but explaining to them how to do the work. I would also encourage you to give back to the community in terms of if we do get into a hit here with the coronavirus, then think about doing something. You want to offer to clean some school buses or ambulances or something, just to realize that it is a community and we're part of that community and we should be part of that. I know I'm running out of time here, Phil. I'm going to try and finish this as fast as possible. When we're talking about cleaning techniques, just remember not every cleaning technique is effective. I would potentially say that this one is very much not effective and probably puts the operator at risk there. Uh, it's interesting, though. A lot of people don't understand that we're using better chemistry. Um, the Defender wipes here is a good example of that. But just having good chemistry is not a substitute for cleaning practices. You can't just go in and spray or fog stuff and think that that's going to take care of everything. It is a process. It's not just an individual product. We can use the best products in the world. I love the Contact disposable microfiber wipes and stuff. But if you don't have good technique, good products, and you don't know how to implement it, it's not going to work for you. A lot of different ways to clean horizontal surfaces. You can see these are washable microfiber pads. Why do we talk about microfibers? They actually do a much better job cleaning than standard wipes, because they, at least on the final pass, they pick up the small particles, including the microbial sized particles. However, we have to be careful that you're not using them with quat-based antimicrobials, because the salts in the quat actually jam up the fibers on the microfiber and take up all those spaces instead of letting the viral and the other microbiologicals get in. Proven to be very effective is to spray and squeegee horizontal surfaces instead of spray and wipe. The squeegee action actually pulls up so much more from the surface of the tables and stuff. And then certainly lots of technology out there. If somebody has a question about specific technology and wants to email me, happy to handle that. But don't just fall for these quick fixes. People bomb it all the time. You can see these cans in here. There's tons of them that are out there. Most of them that are disinfectant and deodorizers are using pentachloropheноls. That is just wicked stuff. You don't want that in your buildings generally. The whole ultraviolet light in the HVAC unit is mostly a joke. And so I would just say, hey, if you're going to try some of this stuff, buyer beware. All right, getting to the end here. What does all this mean? One, it means it's a combination. It's people, technology, and processes that all have to come together to do this right if you're going to help people. And you can see at the bottom, I say this quite often in my infection control classes, 90% right can still be 100% wrong. So the gentleman over there on the left-hand side that's cleaning the subway car, he's got his suit on, he's got his gloves on, he's using some antimicrobial, he's got eye protection on, he's got no respiratory protection. So if he's disturbing any of that or being exposed to those chemicals, the worst place for him is in the respiratory system. The picture on the right, similar sort of process, but notice they've added the respiratory protection, and that makes all the difference. Understand that clean is clean. It's impossible to selectively clean for microbiologicals. If we get the surfaces 100% clean, that means all the viruses are gone, the bacteria is gone, the dirt is gone, everything is gone. That's why a lot of times we do gross cleaning, then come back across with microfiber mops to do the final cleaning. And only then do we apply some of the antimicrobials in terms of fogs and sprays and things, which is there just as a second area to help us, to protect us in case we happen to miss something. Remember, there's lots of choices out there. I'm a big toolbox guy. Some people like SteraMist, some people like Foamit, some people like the EvaCleans and the Clorox 360, blah, blah, blah. My answer is I like them all. They're all useful products. They all have their specialty niches. They all compete with one another. I understand that. But you don't necessarily, if you have one or more of those systems in place, you don't have to necessarily go and run out and buy something special. Just take what you're using as sanitizers, use your standard chemistry, take the expertise you've developed over all these mold projects and stuff, and use it properly. Last but not least, it's science, people. It's not magic. We need to realize that we can break that infection chain. We can break it at any one of those locations and stop that transmission from moving forward. And as I said before, it's not really a secret formula as much as there's a general cookbook out there, and everybody can adopt the recipes to their own taste, so to speak. But once we understand that the cookbook is all about breaking that infectious chain of events, we're going to get there. So, Phil, I don't know if we have time for questions or.
Yeah, Michael. So you got a bit of time. What I wanted to do is bring in Ross Driscoll. I'm going to do it. Yeah, I'm going to bring in Ross Driscoll really quick because I want to have the questions for both of you at the end of this. So I do have a couple questions that were texted in. I'm going to ask anybody that has questions right now to use the chat button on the bottom of the screen to ask those. And I do have a couple that have come in, but Ross, are you there?
Yeah. Hey, Phil.
Perfect. Would you give us a couple minutes, just your understanding of environmental or pollution policies and things we may be looking for in our insurance to make sure we're protecting our risk?
Yeah, glad to help. And great job, Michael.
Well, thank you.
Definitely learned a lot there. It was great. So coronavirus is already having a significant economic impact on industry, especially business interruptions and supply disruptions, where liability risks also exist, especially in things like healthcare, hospitality, transportation, and retail. But remember, there's an absolute pollution exclusion in nearly all general liability policies. So if someone is sued, maybe a local convenience store is sued saying, somebody said they got sick there, they likely wouldn't have any coverage. But business interruptions, especially for retail businesses and logistics companies and manufacturers, if they're interrupted due to businesses being shut down, they're likely going to be the ones seeing the highest frequency of claims. And then workers' comp is certainly a risk, right? It should be the exclusive remedy for any one of your employees that gets hurt, injured, or sick on the job. So, a lot of those techniques that Michael had mentioned and those recommendations are great. One thing I was just reading about that kind of struck me was employment practices liability, EPL. This is a line of insurance a lot of restoration companies don't carry because they're not required to have it by the contractor connections and the alacrities of the world. But that's usually for stuff like sexual harassment and wrongful termination, failing to hire somebody. Pretty much if an employee sues you, that's an employment practice risk. This could be triggered if an employee sues you for, say, not having the right safety procedures or the right protection, or maybe everybody in that city is, told to stay home from work, but you still force them to come into work. That could be an employment practices deal. But you had asked about environmental insurance, Phil. So the good news is that pretty much everybody on the call here has contractor pollution liability. But that said, no two insurance carriers are alike. And the key is the definition of pollutants. So within every policy, any words that are bolded or in quotes are going to be in the definitions. The definitions is one of the most important pieces of the policy. And I mentioned every carrier's definition is different. So I encourage you to read it. A good one, I'll just read right out of one of the policies I'm looking at now. It says pollutants means any solid, liquid, gaseous, thermal irritant, or contaminant. Those are key, including but not limited to smoke, vapor, soot, fumes, acids, alkalis, allergens, viruses, bacteria, Legionella, toxic or hazardous substances, waste, and microbial matter. So, like I said, I would encourage you all to read the definition and ask your agent to confirm that viruses and bacteria are included in the definition. And like I said, everybody's is different. So if those are not included, I would be a little worrisome. But if they are included, bacteria and viruses within the definition, I'd feel pretty good about performing work in contaminated areas.
Okay, great. Thank you. I appreciate that feedback, because I do think that one of the things as business owners, we have to manage risk. I think there's a huge opportunity here. I think there's a huge need. I think we can provide a great service. I love Michael Pinto's ideas of giving back a little bit to your community in this process and being kind of the go-to company. I believe that if in certain circumstances, there's going to be much more demand than we can service. And I've had some conversations with a couple of my clients that are dealing with that at this point. I do think that that there's probably some collaboration that we can do, and that this will be like a catastrophe situation in some communities. Maybe some are bigger than others. I think the interesting news is that the Senate today will sign the deal that will free up about $8 billion or $8.5 billion to address this. So there's going to be a lot of money out there. But I also advise you guys to take care of your cash and to really watch your capital in this process. So I do have a couple of questions I want to get into, and they were very specific about products. So the first one was, we all, or a lot of us, use Benefact. Do the Benefact disinfectant wipes have an effect against the virus, and are they as effective as some of these others?
I believe you're talking with me, Phil, and
Yes, Michael. Sorry.
I would have to look at that, their registration. It's not just the label, but I go back and look at the registration. The first thing we have to understand is that I don't think there's any product right now that is registered against this mutation of the coronavirus, because we just haven't had the virus to test it against. The other thing is that now we have just this morning they were talking about a second mutation of the first mutation. So this virus continues to change. That's why you're looking for products that are tested against the general human coronavirus, like I showed you on the shockwave there. I'm pretty sure the Benefact is also registered against that. But if somebody tells you that, oh, my product is registered for this particular COVID-19, disease-causing virus, don't believe them, because again, it's not there yet. We haven't had that ability to do that testing, at least in regards to products. They're barely got enough of the live viruses now that we have unfortunately, some people who have contracted the disease here in the United States, but they're still trying to test and figure out the actual diagnostic tools. So it's going to be a long ways down the road before somebody would be able to say that their specific product worked on this particular SARS-CoV-2. But make sure it's registered against the general human coronavirus, like you saw on the label on that one slide, and I'm pretty sure Benefect is.
Is there with these products we're using? One of the questions was, does this do the products we use carry a bigger risk than the actual virus itself? And I know that's going to be tough to answer because that's a whole bunch of subjective nature to that. But is there concern on the level of product we're putting into these places, and what do we need to look out for as people who are going to solve a problem, not create a problem?
Well, that's I did mention that on that one, that silver bullet slide where they're talking about some of those bombs where you just let them off in the building. Those are pentachlorophenols. A lot of those have cancer-causing agents associated with them and stuff. So they may be great disinfectants. They may kill the microorganisms, but if they're going to kill the macroorganisms, we don't want that either. So that is a great question. We tend to recommend chemistries and technologies that break down into on their own into inert products. So hydroxyl radicals break down into water vapor and oxygen, and hydrogen peroxide products do the same thing. Essential oils tend to break down like the Benefect. Quaternary ammonium compounds, which is what a lot of our standard sanitizers are, those are salts. Some of them are made with food grade salts. So lots of good chemistry out there, but like you said, you don't need to go up to the kind of nuclear weapons grade antimicrobials for this virus. You need to use good work practices and the sanitizing chemicals as an adjunct to that, not as a substitute.
Okay, so when we go do mold remediation, we get a clearance test at the end of that. Are you recommending, or are you seeing recommendations that there is some physical or quantifiable result at the end of this process?
Well, believe it or not, even though the ATP meters specifically can't measure viruses, they're a really good tool for checking your work because, as I said before, you can't selectively clean surfaces of microbiological contaminants. If you're getting the majority of the dirt off and the majority of the bacteria off and the majority of the mold spores off, you're getting the majority of the virus particles off as well. And as a matter of fact, you may be getting more of the virus particles off because they don't attach as well as some of the bacteria and stuff. So yes, is it surrogate testing? Are we testing the virus itself on the surface? And the answer is no, but it's a way to help us determine whether our visual inspection is actually accurate or not because it's microorganisms. So I'm a big fan of the ATP, and I'm recommending that to a lot of the contractors and clients that we're talking to in regards to the responding to the virus.
Okay, I appreciate it. Should we be cautious about legal definitions of clean, sanitize, or disinfect? And does that make a difference in what we're doing? Are we claiming that we're going to do those things, or are we going to wash, or are we going to treat surfaces? What do you recommend with that?
Generally, when you get into disinfect or sanitize, those are registered or regulated terms in most states, and it is state by state, so you have to be a little careful. Most states, the vast majority of states, you're safe if you say you're going to clean and sanitize, which means that you're going to clean the physical dirt away, and sanitize implies that you're going to remove or kill some of the microbiologicals. But yes, I would stay away from the terms disinfect or sterilize because that definitely puts you into a regulated ballpark.
So you just said some of the contaminants. Is there a legal definition? Because I think, I took my certified restorer exam. That was one of the things they really worked on and talked about, was there are legal definitions of all of those words. And is that something we should be aware of? So if we come in and put in our contract that we're going to sanitize, does that then a scientist can come in and say, you never sanitize this? Or one of the things I've talked to somebody else as well is the only thing we can guarantee is, or not guarantee, that we can claim is that we have a certain level of clean at the moment, the second we're done. And then as soon as somebody else walks in the building, we have no more claim of any quantifiable outcomes, because we can't control who just walked in and what they were carrying when they walked in.
Right. Yeah, that's, again, another good points in digging into the details there. But generally, the term sanitize, most definitions in most states uses the words reduce microorganisms or level of microorganisms. It doesn't put a percentage on it, like when you start to get into disinfectant, they say that you want a 4-log kill or a 6-log kill, meaning that you're getting to 4-log kill 99.99% of the rated microorganisms are going to be dead. That's disinfect, that's sterilize. Sanitize, they generally just use the word reduce in the definition. And certainly I think we're meeting that criteria. But again, educating your client that if they don't use the right personnel policies, we can clean and we can sanitize an entire office building. And if they allow sick people to come back in the building, they're going to have more sick people. That's why the people side has to work with the process side. And it's the human resources end of some of the companies and the schools and the medical facilities and the nursing homes and stuff that may prove more valuable even than some of the cleaning that we're doing.
Okay, fantastic. One of the things I mentioned that we were not going to talk about, and I'm not going to ask you to talk about it, but I just wanted to direct everybody who is listening to this presentation. There is a legal element to this, and I think that you need to spend time talking with your attorneys, or you can talk amongst yourself, but you guys need to figure out what your legal requirements are here, what your paperwork looks like, what your contracts look like, what you're explaining to people and what you're telling them you're going to do. And then there's also the insurance and legal side of your employee and staff members. So you need to tend to those things. I think that is one of the preliminary foundation building steps anybody who is going to undertake any of this process or this work needs to do and needs to be aware of. And so I think that before you do anything, take those steps and move forward in that. I don't know if do you have any comments on that, Michael? I'm not sure that it's not your realm, but if you do, let me know.
Well, again, it's always good to be cautious, and it's good to chat with people and everything. But at some point, we have to offer the services. And I think it goes back to that slide that I put in there where it says, if you're going to do it, just do it right. I mean, if you really want to protect yourself from liability, don't do stupid stuff and don't do bad stuff. And, that's a layperson talking. But, understand what you're doing. Don't oversell it, like we were just talking about with the language. Be careful with the language and stuff. And then if you tell somebody you're going to be in there and you're going to wipe all the touch points for them, make sure you've got good supervision and good documentation that you wipe the touch points. You can't just tell them you're going to do stuff and then through a lack of employees or lack of supervision or a lack of product or something not do what you said. That's where the fraud comes in. That's where the bad faith claims are going to come. So
great,
sell it right, do it right.
Yeah, I like I'm going to use this is the scientific answer to that. Don't be stupid. Great. I love that. Okay.
I told you at the beginning, I take it down to the practical level. What can I say?
Perfect. I love that. I think everybody can grab that and really use that as at least just kind of a guiding principle. And then from there, I think that being prepared makes sense. One of the things you had said, and I just want to reiterate this, and this is my wrap up thoughts here, is that we need to, as you said, talk about the posters, but I think we need to have frequent meetings with your staff, particularly if we're working on these jobs or if we're just encountering illness in our communities. We have to talk with our staff and we have to communicate with them what our expectations are what we're asking them to do, where they're going to be, what environments they're working in, what the risk factors are, so they're fully aware. And I think that in one of the respects is if we're coming in and we're properly prepared, even if we're working in these environments, I think that when we control the things we can control, I think we're creating a level of safety for our employees because we have the controls in place, and it makes it more deliberate and more apparent, so we know what we're dealing with. And I think that we can have at least express some level of confidence that we're taking care of our staff. And so communicate with your staff. I think it makes a ton of sense. I don't know if there was anything else, anything else you wanted to add to that, Michael. I agree. I appreciate your time and your wisdom and the ideas that you shared with us. I think there's a lot we can take away from this. I don't have any other questions that have come in. So any closing statements from Michael or closing statements from Ross, and then we'll wrap things up.
Yeah, I do want to build on that last one. The last comment I'd like to make is that, when we're talking about that first priority, taking care of ourselves and our crew, we also have to be realistic and understand that some of the family members and some of our own staff members may become ill. And if that's the case, even just sharing some product with them so that other family members can clean and sanitize surfaces in their house, providing masks so that other family members don't become sick because you can put a mask on the ill individual. Just realize everything that we talked about today, we may have to extend that out to our family in terms of our work family. And if we keep that in mind, I think that will build the sort of relationships in your company and the loyalty that can't be bought just with a paycheck.
Yeah, I think that Zig Ziglar once said, "You can't be at home thinking about work, and you can't be at work thinking about at home." And so, if you can take care of those other elements, so you can be fully present at whatever environment you're in, that will be a really good thing. Ross, anything that you wanted to share at the end?
No, I think great job. Just check your definition, pollutants.
Okay, fantastic. Thank you very much. We've recorded the presentation. I'm not sure I actually recorded my first introduction, but we got 100% of Michael's, and we can be available for any questions you have. You can respond to me, and then I'll forward those on to Michael. And I appreciate your time. Thank you very much, Michael. Thank you very much, everybody, for being here.
God bless you. Thanks, Phil.